This is the Wikipedia page for Dura Mater. Welcome to WikiListen, the podcast where we read Wikipedia pages and provide commentary. I'm Victor Varnado, KSN.
And I'm Rachel Teichman, LMSW.
This episode is all about this thing. I think I actually heard of this. Okay, so Dura Mater is a part of the brain. It's like a layer of the brain. And the reason I heard about this because I was watching a horror special effects show, and they were talking about making someone's head blow up, and they were like, you have to do this and you have to do that, and you got to make sure that you see the Dura Mater flap. And I was like, what is he talking about? So I looked it up, and this is what we're reading today.
All right, everybody, get ready for this anatomy lesson.
All right. Dura Mater. Dura Mater is a thick membrane made of dense, irregular connective tissue that surrounds the brain and spinal cord. It is the outermost of the three layers of membrane called the meninges that protect the central nervous system. The other two meningeal layers are the arachnoid mater and the pia mater. The dura surrounds the brain and the spinal cord. It envelops the arachnoid mater, which is responsible for keeping in the cerebrospinal fluid. It is derived primarily from the neural crest cell population with postnatal contributors of the paraxial mesoderm. Wow, this is going to be one of those articles. I can tell.
Thankfully, this is not that long of an article.
Yeah.
Structure. The dura mater has several functions and layers. The dura mater is a membrane that envelopes the arachnoid mater. It surrounds and supports the dural sinuses, also called dural venous sinuses, cerebral sinuses, or cranial sinuses, and carries blood from the brain toward the heart.
Cranial dura mater has two layers called lamellae, a superficial layer also called the peristeel layer, which serves as the skull's inner periosteum, called the endocranium, and a deep layer called the meningeal layer. When it covers the spinal cord, it is known as the dural sac or thecal sac. Unlike cranial dura mater, spinal dura mater only has one layer known as the meningeal layer. The potential space between these two layers is known as the epidural space.
Sac.
Thecal sac.
Let me punch you right in the thecal sac.
Gross.
Folds and reflections. The dura separates into two layers at dural reflections, also known as dural folds, places where the inner dural layer is reflected as sheet-like protrusions into the cranial cavity. There are two main dural reflections. The tentorium cerebelli exists between and separates the cerebellum and brainstem from the occipital lobes of the cerebrum.
The falx cerebri, which separates the two hemispheres of the brain, is located in the longitudinal cerebral fissure between the hemispheres.
Two other dural infoldings are the cerebellar falx and the sellar diaphragm. The cerebellar falx cerebelli, is a vertical dural infolding that lies inferior to the cerebellar tentorium in the posterior part of the posterior cranial fossa. It partially separates the cerebellar hemispheres. I understand a lot of this.
I get understanding's not the point. I'm just saying this feels like when I was in grade school reading in front of class. It's just like you're going to get hit in the face with some medical word that is just you're going to trip over, and no matter how hard you try, it's going to get out there to the world, and they're going to know what an idiot I am.
We have social anxiety here at WikiListen.
The sellar diaphragm is the smallest dural infolding and is a circular sheet of dura that is suspended between the clinoid processes, forming a partial roof over the hyperphyseal fossa. The sellar diaphragm covers the pituitary gland in this fossa and has an aperture for passage of the infundibulum. Infundibulum, pituitary stalk, and hypophyseal veins.
Infundibulum.
Infundibulum.
Blood supply. This section does not cite any sources. Please help improve this section by adding citations to reliable
what is this
sources.
doing in here if it doesn't cite any sources? Isn't that like against Wikipedia rules?
Unsourced material may be challenged and removed. January 2020.
Oh,
Learn
I
how
didn't read
and when
ahead.
to remove this template message.
Got it.
This depends upon the area of the cranial cavity. In the anterior cranial fossa, the anterior meningeal artery, branch from the ethmoidal artery, is responsible for blood supply. In the middle cranial fossa, the middle meningeal artery and some accessory arteries are responsible for blood supply. The middle meningeal artery is a direct branch from the maxillary artery and enter the cranial cavity through the foramen spinosum and then divides into anterior, which runs usually in vertical direction across the pterion, and posterior, which runs posterior-superiorly branches, while the accessory meningeal arteries, which are branches from the maxillary artery, enter the skull through foramen ovale and supply area between the two foramina. And the in posterior cranial fossa, the dura mater has numerous blood supply from different possible arteries.
What the fuck are you talking about?
I understand about 75% of that.
Okay,
About
great.
Solid 75%.
Not
and you know
me,
what?
man. No.
C's get degrees. I did get a C when I took anatomy.
This is a list. A posterior meningeal artery from the ascending pharyngeal artery through the jugular foramen.
B, meningeal arteries from the ascending pharyngeal artery through hypoglossal canal.
Show off. C, meningeal arteries from occipital artery through jugular or mastoid foramen.
D, meningeal arteries from vertebral artery through foramen magnum.
Should I have been saying meningeal all the time?
I don't know. I think so, but I honestly don't know.
All right. Drainage. This section does not cite any sources. Please help improve this section by adding citations to reliable sources. Unsourced material may be challenged and removed. January 2020. Learn how and when to remove this template message. The two layers of Dura Mater run together throughout most of the skull. Aww. Isn't that nice? They run together. Where they separate, the gap between them is called a dural venous sinus. These sinuses drain blood and cerebrospinal fluid, CSF, from the brain and empty into the internal jugular vein.
Arachnoid villi, which are outgrowths of the arachnoid mater, the middle meningeal layer, extend into the dural venous sinuses to drain CSF. These villi act as one-way valves. Meningeal veins, which course through the dura mater, and bridging veins, which drain the underlying neural tissue and puncture the dura mater, empty into these dural sinuses. A rupture of a bridging vein causes a subdural hematoma.
Nerve supply. The supraterritorial dura mater membrane is supplied by small meningeal branches of the trigeminal nerve. V1, V2, and V3. The innervation for the infratentorial dura mater are via upper cervical nerves and the meningeal branch of the vagus nerve.
Clinical significance. Many medical conditions involve the dura mater. A subdural hematoma occurs when there is an abnormal collection of blood between the dura and the arachnoid, usually as a result of torn bridging veins secondary to head trauma. An epidural hematoma is a collection of blood between the dura and the inner surface of the skull, and is usually due to arterial bleeding. Intradural procedures, such as removal of a brain tumor or treatment of trigeminal neuralgia via a microvascular decompression, require that an incision is made to the dura mater. To achieve a watertight repair and avoid potential post-operative complications, the dura is typically closed with sutures. If there is a dural deficiency, then a dural substitute may be used to replace this membrane. Small gaps in the dura can be covered with a surgical sealant film.
This is great. I am learning a lot, actually. I mean, it is difficult to go through, but I am learning a lot. In 2011, researchers discovered a connective tissue bridge from the rectus capitis posterior major to the cervical dura mater. I want to know what the rectus capitis is because if it has to do with the butt, I gotta know. And I'm assuming yes, right? It's a butt thing. Isn't it a butt thing?
I don't think so, no.
Okay. You know what? I'm going to look it up later.
I'm pretty sure you're wrong. Yeah.
Okay, but I want it to be a butt thing because it's called a rectus.
I also want it to be a butt thing, but unfortunately, I don't think it is.
Various clinical manifestations may be linked to this anatomical relationship, such as headaches, trigeminal neuralgia, and other symptoms that involve the cervical dura. The rectus capitis posterior minor has a similar attachment. This has got to be... No, it's not. It's the bottom of the skull. It is kind of a butt. It's like the skull's butt. Like even the picture looks like a butt on the skull. If you look over, if you put your pointer over, yeah, kind of as a butt over on the skull. Look at that.
Yeah, because
skull butt.
Rectus is one of the directional terms. It's an adjective.
It's an adjective.
Yeah.
Great.
The duramuscular duraligamentus connections in the upper cervical spine and occipital areas may provide anatomic and physiologic answers to the cause of the cervicogenic headache. The proposal would further explain manipulation's efficacy in the treatment of cervicogenic headache.
The American Red Cross and some other agencies accepting blood donations consider Dura Mater transplants along with receipt of pituitary-derived growth hormone a risk factor due to concerns about Creutzfeldt-Jakob disease.
Tonsillar ectopia, or Chiari, is a condition that was previously thought to be congenital but can be induced by trauma, particularly whiplash trauma. Dural strain may be pulling the cerebellum inferiorly, or skull distortions may be pushing the brain inferiorly.
Dural ectasia is enlargement of the dura and is common in connective tissue disorders such as Marfan syndrome and Ehlers-Danlos syndrome. These conditions are sometimes found in conjunction with Arnold-Chiari malformation.
Spontaneous cerebrospinal fluid leak is the fluid and pressure loss of spinal fluid due to holes in the dura mater, and that's a big deal.
Hey, Rachel, did you know that Chiari malformation is a structural defect in the cerebellum characterized by a downward displacement of one or both cerebellar tonsils through the foramen magnum? CMs can cause headaches, difficulty swallowing, vomiting, dizziness, neck pain, unsteady gait, poor hand. And it ends at poor hand.
No, I did not know that, but thank you for telling me, and I'll know to look out for it.
Anytime. Etymology. The name Dura Mater derives from the Latin for tough mother or hard mother.
Hard mother.
A loan translation of Arabic, al-Dimaj al-Safika. I don't think I got that right. Literally, thick mother of the brain, matrix of the brain, and is also referred to by the term pachymeninx, plural, pachymeninges.
There you have it.
That
the
is
Dura Mater.
All of it. And I learned a little bit. I would say that if knowing everything that this page was talking about was 100% of the information, I think I learned 15% more than I knew coming in here. I learned 15% of the information.
I would say about 35% of the battle in understanding this stuff is like understanding like a lot of the basic adjectives like posterior or like rectus. Like those are all adjectives. And so like it all becomes a lot clearer when you know those.
I think that my battle with this though is because I was reading it and concentrating on trying to pronounce these words that are just like made up by some freaking lunatic. I was focusing on that more than learning.
That's fair.
Is what I think. Fair? Thanks.
You're welcome.
This has been the Wikipedia page for Dura Mater.
Thanks for listening to WikiListen. You can find us at wikilisten.com and on all social media at WikiListen, except for Twitter, which is at wiki_listen.
If you want us to read a particular Wikipedia page, please let us know. You Dura Mater to us.